Hi, everybody. I'm Yaniton, and today I would like to share what I have learned during this day. The topic is variable performance marks in oxygen delivery. This is very important for every healthcare professionals. The contents are the introductions and the main topic, variable performance marks. The introduction will reveal what oxygen delivery devices are and their classifications. Frankly, oxygen delivery devices can be classified into variable performance devices and the fixed performance devices, depending on their ability to deliver set FiO2. FiO2 means fractional inspired oxygen concentration. The normal FiO2 in the air is 0.21. Variable performance devices means that they deliver a fluctuating FiO2. This means that their performance differs between persons or even in the same persons. This differ from breath to breath. Examples are the most commonly used simple face masks or the Hudson face masks and partial rebreathing masks, also known as non-rebreather masks, nasal cannula, and then nasal catheter. Okay, the picture on the right is the simple face mask, and on the left is the face mask with the reservoir bag. And these are the photos of nasal cannula or the nasal prong and nasal catheter. Okay, fixed performance devices deliver a more constant and predictable fractional inhalation of oxygen. Examples are the Vangeri operated devices or anesthetic breathing systems with a suitably large reservoir. Okay, well, variable performance masks are also known as low flow oxygen delivery devices. They are called low flow because they cannot give the whole oxygen demand of the patients. Variable performance masks are widely used in hospital uh, because of the greater patient comfort, low cost, they are simple, and then the ability to manipulate the FiO2 without changing the appliance. For example, when using Vangeri mask, when we want to manipulate the FiO2, we have to change the devices. Components are plastic body of the marks with the side hole put on both sides. Later, I will explain what the function of side hole is. The plastic body is transparent to inspect the secretions and the vomitings of the patient. And then there is a part connected to an oxygen supply, and the other thing is the elastic band that fixes the marks to the patient face. This is all important because the tightness of the face marks to the face depends on the elastic band. This in turn determines the fractional inhaled oxygen to the patient. Okay, next is the mechanism of action. From the side hole, ambient air is entered and dilution of the fresh gas supply occurs. The hole also serves to vent the exhaled gases out. There is an expiratory pause in normal physiology of the respiration. This is also very important in the mechanism of face masks. During expiratory pause, the fresh gas supplied help in venting the exhaled gases out of the side hole. The body of the mask is filled with the fresh oxygen supply and is available for the next step of inspiration. Okay, I will explain it with figure. During the expiratory pause, there will be the exhaled gases in the body of the face mask. Because of the fresh oxygen supply, exhaled gases will be vented out from the side holes, and fresh oxygen will occupy in the body of the face mask. Ambient air also enters from the face side holes of the face mask, so dilution of the fresh oxygen supply occurs, and the oxygen supply to the patient is fresh oxygen and ambient air. Okay, let's discuss about the factors that affect the delivery of FiO2. FiO2 delivery depend on peak inspiratory flow rate, respiratory rate, fresh oxygen flow rate, and how much fit the face mask is. I will explain later the importance of peak inspiratory flow rate in delivery FiO2. If it's an reversely related, if there is low peak inspiratory flow rate, high FiO2 can be delivered to the patient. In the same way, respiratory rate relates inversely to the FiO2 delivered. This means that in fast respiratory rate, there is less expiratory pause, and the patient will rebreathe their alveolar gases, expired alveolar gases. So the FiO2 will be low. Next, I will explain it with figure. There is no doubt that the higher the fresh oxygen flow rate, the higher will be the FiO2 delivered. And then tightness of the face mask to the face also important in determining the FiO2 delivered. This may be a problem in patient with Raiju, and then edentulous patient, it means the patient without teeth. Pattern of ventilation. If there is a pause between expiration and inspiration, the mask filled with oxygen and high concentration is available at the start of the inspiration. If there is no expiratory pause or less expiratory pause in high respiratory rate, alveolar gases will maybe rebreathe from the mask at the start of the inspiration. So if there is no expiratory pause, AC gases will not vent out from the side hole. So the inspired oxygen will include exhale gases, it means rebreathing, and fresh oxygen supply and the ambient air. Actually, rebreathing of oxygen is usually of little clinical significance in adults, but it may be a problem in patients who cannot compensate by increasing their alveolar ventilations, example in patients with a chronic lung disease. If rebreathing occurs, the patient may experience a sense of warmth and humidity. Oxygen elimination can be improved by increasing the fresh oxygen flow. If you have a doubt that there is a rebreathing, you can increase the fresh oxygen flow to increase carbon dioxide elimination. Carbon dioxide elimination is inversely related to minute ventilation. You know, minute ventilation is the multiplications of tidal volume and respiratory rate. If there is an increased respiratory rate, low FiO2 is delivered, and then there is much rebreathing. The rebreathing is increased when the mask's body is large. So pediatric mask has a less volume of the mask's body. Mask's body is also a contribution to the appliance dead space. And rebreathing is also increased when the resistance to flow from the side is high. It occurs when the mask is very fit. Let's move on to the inspiratory flow rate, which is also a determinant of FiO2 delivery to the patient. In normal tidal ventilation, the peak inspiratory flow rate is 20 to 30 liters per minute, it is much greater than fresh oxygen flow. So to meet the demands of the inspiratory flow rate, ambient air also enter into the body of the mask, so dilution occur. So inspiratory flow rate is about 20 to 30 liter. Fresh oxygen flow may be the 4, 5, or 10 liter. And to meet the demand, ambient air also enter into the face mask body. So if there is an higher inspiratory flow rate, more ambient air enter into the body of the mask and more dilution occur and less FiO2 is delivered to the patient. So inspiratory flow rate is inversely proportionate to the FiO2 delivered. The peak inspiratory flow rate can be increased in deep breath inspiration and during hyperventilation. Okay, a typical example of 4 liter per minute oxygen flow deliver an FiO2 of about 0.35 to 0.4, providing there is normal respiratory pattern. It means that there is an enough expiratory pause and normal respiratory rate. Okay, the next topic is the rule of the reservoir bag. Reservoir bag means adding a 600 to 800 ml of bag to the max. It serves as an extra reservoir. Such marks are also known as partial rebreathing marks or non-rebreathing marks. I think it is more true to say partial rebreathing marks. Okay, this is a figure of a marks with the reservoir bag, and there is a reservoir bag and fresh oxygen supply, and then the one-way bath. One-way bath is between the marks and the reservoir. It prevents the exhale gases to enter into the reservoir bag. So the oxygen in the reservoir bag is 100%. So the inspired oxygen is derived from continuous fresh oxygen supply and oxygen present in the reservoir and the entering ambient air. So high FiO2 can be obtained by using the reservoir bag. In normal face masks, the inspired oxygen is derived from continuous fresh oxygen supply and entering ambient air. Next is tracheostomy masks. Similar masks can be used, but true tracheostomy masks has a little different morphology from their usual face masks. The important thing is to humidify the inspired dry oxygen because the gas is delivered by past the nose and its humidification. Okay, well, problems in priorities and safety features for the face masks is that these devices are used only when delivering a fixed oxygen concentration is not critical. It means that um, if the whole patient's entire ventilatory requirement is not necessary, the patient whose ventilation is dependent on the hypoxia drive must not receive oxygen from a variable phase performance face mask. They would rather use fixed oxygen delivery devices. So that's all, and thank you for viewing my video. And this is my reference book. Please subscribe my YouTube channel. Thank you.